I'm going to go ahead and I'll start saying hello to you all, and then we'll just roll some more people in, and especially won't officially start unless Dr. Lalani is having some challenges with getting here, but hopefully not. I want to welcome all of you who are here. I'm Nicole Golden, the Executive Director of Texas Gun Sense, and I'm just so glad that you joined us and are spending an hour of your evening with us. I know it's not easy. I was just talking to some of our speakers who are managing being busy doctors and parents and so many other things. We might have some children pop into the screen apparently if they if Dr. Gamble's kids need something, but that's how this works. So we're just so glad that you all are here, and I know you're balancing a lot of things too, and we appreciate your time. Um, as I mentioned, I'm the executive director of Texas Gun Sense. I know some of you, I recognize some familiar names. I do want to give a special shout out to our staff, Garrett and Laura, who are here, our board member, Mary Stone and Lewis Witchers. And then we also have we have some wonderful speakers who we're going to officially introduce, but I see in the audience some doctors that we have relationships with that we're so glad joined us. Dr. Sue Bornstein. Let's see. I hope I'm not missing others, but I recognize other names of supporters who have joined us at other things, and thank you. One of the things we've been talking about at Texas Gun Sense is doing formalizing our healthcare partnerships. And when I say healthcare, that includes doctors, mental health experts, nurses, and everyone who's part of that field who does such important work with clients and patients. And so this is our exciting kickoff to show how important this is and how much we want to be a resource to healthcare professionals and also be listening to healthcare professionals about what's needed when it comes to gun safety, helping to activate your networks, helping to connect you to our work at the Capitol and the work that we've done on safe gun storage and other things that feel really critically important. One of the ways I connected with some of you, I'm thinking of you, especially Dr. Bornstein, is that we have had some success with safe gun storage. And we're working really hard to build on that. And I remember, going to an event, Sue, that you had, and we talked about a policy we passed last session that requires school districts to now send out safe gun storage information to parents and guardians of Texas school children. And we're building on that. It's being implemented pretty effectively by the Texas School Safety Center. And there's just so much I think we can do to keep that work going and to work with you all as partners on safe gun storage and other gun safety measures that we know most people agree with and that we've been able to make some headway with till now. So I want to keep hope alive that work is being done, progress is being made, and there's a lot more that we can do. So we'll touch on some of that tonight, and then we'll have a lot more healthcare opportunities to collaborate moving forward. Garrett, I'm going to kick it over to you.
Thank you. Yeah, I will go ahead and get us started. I think we're still waiting on, I'm looking through the participants. I think we're still waiting for Representative Lalani, but they are getting it figured out. So if I pause randomly, y'all, thank you for your patience. Well, welcome everybody for joining. We're really excited to have you here. So this is the inaugural webinar for Texas Healthcare Partners for Gun Safety. This is our program at Texas Gun Sense geared towards really empowering healthcare professionals, mental health professionals to advocate for gun safety reform at the state level. There are a lot of groups doing the work to mobilize different communities, and we really just wanted to make sure that we're leveraging the resources that we have to allow these folks to advocate for their patients and their communities in the way that they can do best. So again, we are going to have a few doctors and people with healthcare backgrounds on this call. We'll be hopping around a little bit with some panel questions as the legislators hop on, just because they have a little bit tighter of a schedule. So bear with us on the question order, and then we'll open it up for a Q&A at the end. And I'm going to, let me scroll down to these bios. I'll go ahead and introduce Dr. Gamble. Dr. Lauren Gamble is a pediatrician and child health advocate. She's nationally recognized speaker for pediatric advocacy with a specific focus on gun violence prevention in children. She holds several national and statewide positions in pediatrics and advocacy and has appeared in the media many times to educate on the gun violence epidemic in children and has authored works in both the academic and popular press on this topic. She's also an advisory board member of Texas Gun Sense. I'll also introduce one of our speakers, Dr. Cedric Dark. Dr. Dark is an associate professor in the Henry J. N. Taub Department of Emergency Medicine at Baylor College of Medicine. He's a former board member for Doctors of America and is currently on the board of trustees for Semester at Sea and is the medical editor-in-chief for the monthly publication ACEP Now. When not saving lives at the bedside, Dr. Dark strives to save them through policy. His policy experience includes work for the U.S. House of Representatives, the Kaiser Family Foundation, and the 2020 Joe Biden campaign. And he's also published his first book, Under the Gun, an ER Doctor's Cure for America's Gun Epidemic, that explores how we can save Americans' lives before the bullet leaves the gun. So welcome and thank you to both of these speakers. And I'll give the intros in just a bit for the legislators when they are able to hop on. In the meantime,
Garrett, can I take a quick moment just to announce a couple more people I saw who joined, if you don't mind?
yeah, absolutely.
Dr. Estrada, thank you for being here. Dr. Jaime Estrada is from Texas Doctors for Social Responsibility, another really key partner in gun safety. I see Lisa Ross from Lock Arms for Life, another coalition partner who does great work on safe storage. Gosh, I saw JJ Janflone from Brady. They have an excellent program and Family Fire. Sneha, thank you for being here. Sneha is one of our student advocates, and there's others of you have, please feel free to introduce yourselves in the chat and talk about what it is that you do, but thank you everybody for being here. Go ahead, Garrett.
Gary, you're on mute.
You're
You're
muted.
muted.
There we go. I knew that would happen at some point. To start, if Dr. Gamble and Dr. Dark, if y'all could share why gun violence prevention is an important issue in your work and how your role in healthcare intersects with this advocacy.
I'll start because I saw that I was off mute already. So, I think for me, I'm an emergency physician. I work at Benton Hospital. And so it's something that we tend to see fairly commonly. I think they say maybe about 600 or so gunshot wound patients come in every year. So if you average that out, you know, a couple a day. Usually, though, we clump them on nights and weekends. Sometimes Houston decides not to behave like it ought to, and they're sprinkled in on random Wednesdays. You never know. But I think for me, that's where I get a lot of it is just through patient care and sort of the interaction that I have with our community through the emergency department.
And I'll say, I think probably when you picked emergency medicine, you knew that was going to be part of your job. I did not pick pediatrics thinking that it would be a significant part of my job necessarily. But I became a pediatrician because I wanted to improve the health of children. And probably everybody on this call knows that firearm violence is the number one killer of kids. And so, honestly, I'd love to work on another topic, literally anything, I think, really. But this is the topic this is the epidemic of our time within pediatrics. And so, to kind of reach my personal professional goals of improving the health and the lives of children, this is a topic that I have to work on, and that I have to spend my time and energy on because it's the reality of pediatrics.
Thank you. Yeah, it's definitely an issue that I think a lot of us, healthcare and otherwise, didn't expect to be working in. And I'm glad that we've got these valuable voices in the movement. It would definitely, from the kind of data-driven and science-driven and experience-driven backgrounds that you all bring to the fight, it's definitely something that we couldn't do without. And sorry, give me one more second. As a lot of you know, we had a technical glitch with Every Action and Zoom communicating, and our Zoom link did not go out to everyone, so I'm adding everybody in. So, Dr. Gamble, I'll toss it to you. As a pediatrician, what trends or challenges have you observed in how gun violence affects children and adolescents, and how do you address these issues, like in your practice specifically?
Yeah, I mean, there's a lot of different ways to think about this, right? I mean, like I mentioned, and we all know that firearm violence is the number one killer of kids. And I think that's obviously something huge and important that we have to talk about. And we have to say it, loud from the rooftops for anybody that will listen, and even if they're not listening. But I think specifically as a pediatrician, the epidemic that we talk less about is really the profound mental health ripples that I see from this gun violence. And so, our kids are traumatized by these events. They're traumatized directly when they're, kind of part of these gun violence acts. They're traumatized indirectly when they know a friend of a friend, or they see something in the media, or they see something on social media. And I think that's playing out in the mental health trends that we're seeing in kids. Kids are scared to go to school. They have skyrocketing rates of depression, of anxiety, sleep disorders, mood disorders. And I think all of that is kind of living in this world where they don't feel safe. They don't feel safe to go to school. They don't feel safe to go out in large groups and be in concerts and those sorts of things. And I think that impact, we don't talk about it enough. And I think it's really hard to quantify. I'm a hospital-based pediatrician, so I take care of a lot of kids in mental health crisis who are contemplating or have attempted suicide. And a lot of it is kind of directly tied to this real heightened level of stress that they feel every single day, day in and day out. And I think that impact is on our kids now. And I think it's an impact that we're going to see for generations. And I don't even think we're close to being able to quantify what those ripples are going to do to our communities.
I'm
How
Dr.
to
Meena.
fix it, I think you asked. I think what I do about it, I think, is just I mean, I do this work, right, to try to fix it, like Dr. Dark's book says, is like, how do we stop this before the bullet leaves the gun, right? How do we prevent this, and kind of work from that square one, I think is the most important thing.
I'm Dr. Meena. I'm just interested in asking one question. If an individual will not grow up with inhibitory control, self-regulation, and discrimination, that is imparted before the child is 3 years of age into the brain as a pathway to the prefrontal cortex. Just trying to touch, controlling something, aggression, once it's already there, is what is failing the society. That's what I feel. While we are working with the current mental health crisis, there is also 1 out of 4 have been the victims of ACEs, which they are burning volcanoes. And Dr. Bruce Duncan Perry taught about this 35 years ago.
Right.
We are not
We do have
addressing the parents and the didactic teaching, how to impart cognitive development, emotional regulation, cognitive flexibility, and self-regulation. That happens 0 to 3. I just
we're
want to bring it up to the discussion.
we're going to open it up for Q&A at the end of the webinar. I am going to have to, just because we have limited time with the speaker, I am going to introduce State Senator Molly Cook, who has joined us. So Senator Cook is, sorry, I got to pull back up my thing. Molly Cook is a Texan ER nurse, community organizer, and Democratic Senator for Texas Senate District 15. With a master's in public health policy from Johns Hopkins, she's led impactful campaigns like Fair for Houston, which passed Prop B with a 30-point margin. Senator Cook combines her frontline healthcare experience and organizing expertise to champion policies that improve quality of life and save lives. Everyone, welcome Senator Cook. And to just dive right in, Senator Cook, as an ER nurse, what experiences with gun violence survivors or victims have stood out to you, and how have those stories shaped your organizing and your legislative advocacy?
Yeah, and thank you all so much. So happy to be here with you tonight, and thank you for the work that you do. It's life-saving, and these are such important conversations. I'm so grateful to be having them with y'all in this new capacity, especially. I do not work at a trauma hospital, which in some ways almost adds even more credibility to the fact that I can tell you that there's a very serious and chronic issue with gun violence especially with folks under the age of 30, under the age of 25. So what I see sometimes is when somebody doesn't understand that they should go to a trauma hospital to drop their friend off, we'll get folks, just dumped out of a car in the ambulance dock. And then we have to bring them in and treat the gunshot wound and figure out what to do from there. Sometimes we'll see like less lethal types of gunshot wounds. And so we'll see ones if there's, maybe a mass casualty event or there's more than one person involved, the least injured person will end up at my hospital. But what I see on a really frequent basis, that's the big motivator for what I, want to do from this Texas Senate seat is this kind of constant, chronic, slow burn of gun violence. People who live with bullets in their body forever. People who have spinal cord injuries that they live with forever. Folks who are living with ileostomies and colostomies and livable lives, right? Like these are disabilities. You can live a very full life with them, but nonetheless, they've been very costly. They caused harm, and people's families and lives are changed forever by it. And I see a lot of it in folks that are just so young. People hanging out at a park and a gunfight breaks out. I mean, that's just not something that should be happening in today's world. So it's very just very chronic, very continuous, very present. And from what I've seen over the last 10 years of being an ER nurse, it's getting worse and not getting better.
Thank you. And with your background in healthcare in particular, what advice would you give to other healthcare professionals and young people going into the healthcare field that are interested in using their experiences to influence policy and possibly eventually run for office?
Oh, I feel like that's a bunch of really awesome questions. First, I'll kind of speak to healthcare providers and professionals. I will tell you, if you don't love the position that perhaps a professional advocacy organization takes, then I encourage you to join your professional advocacy organizations. I will speak freely with y'all. I wish more healthcare professionals were more politically engaged. Some are very politically engaged, and Texas is a little bit of a different beast than other states. But I think we should see doctors and nurses and pharmacists and respiratory technicians. Everybody should be out in the streets and talking about this. We know the laws that will save lives, that will prevent gun violence, like Dr. Gambill was saying before the bullet even leaves the gun. We know these things, and what we really need is to shift power to the people of Texas who overwhelmingly support if it's high risk protection orders or universal background check, all the things that I'm sure you all have already talked about on this call and talk about all the time. And so I want to see people joining their professional organizations to kind of shift the ethos and shift the policies that those organizations present. And then I think as young people, just continuously speaking out and ringing the alarm. I actually had a conversation recently with someone around the freeway work that I've done before. So trying to stop the displacement of homes by freeways and instead investing in multimodal transportation, which is much safer, much more efficient. And in many ways, especially with an administration change, we're back to where we started. And where we started was scrappy grassroots direct action to call attention to what's happening, to raise the profile of the issue, to get press on it, to keep shifting the narrative, and to build capacity and draw more people into the fight and give people a sense of hope for change. And with a new administration change around gun violence, I think it's probably pretty similar. Our backs are against the wall, and we need to link arms, stick together, and be thinking of, how do you throw the kitchen sink at this? What have we not tried? How can we escalate kind of the fever pitch and continue to keep press on this and continue to tell the story that the choice that lawmakers are making is to put children in the line of fire. That's just the truth, and we need to keep telling that story. For folks who are thinking about running for office, I think it's important not to be afraid of talking about gun violence and how important it is, and to just lean into the fact that these are common sense safety reforms. It's not left wing. It's not radical. It's not out of the ordinary to want to stop, especially kiddos, from dying. But as we know, the high rates of suicide in older men, these are really big deals, and it's okay to talk about them. And then I encourage folks to run for office or to really get involved and learn how to be good staff, either campaign staff or office side staff. especially in Harris County, I'll speak for myself, we have a real lack of good campaign infrastructure. And so even if you don't want to run for office, or if you think that might be in your future one day, working as a staff member in an office or working as staff on campaigns is really important for shaping the kind of leadership that we want to see, that's bold and will take action on even something that can be scary, like gun violence.
Thank you. Those are great. Great. That's great advice for people wanting to get more involved. And for those who weren't able to make it, Senator Cook was able to join one of our um, uh, youth kind of advocacy focused webinars recently, and gave really great advice as well for just young people getting involved and wanting to join the movement. Um, I do have one more question that I'll start with you on, Senator Cook, but really quick, I do want to mention, since he's joined, we are grateful to have State Representative Suleiman Lalani. Dr. Lalani is a physician and the first Muslim and South Asian elected to represent Fort Bend's House District 76. Combining medical expertise with public service, he co-sponsored bills expanding mental health services and postpartum Medicaid. And Dr. Lalani is also dedicated to philanthropy and community service. So really grateful to have all of these great experts here. So just to, since you have a little bit more limited time, Senator Cook, I'll start with you, but I want to toss this to all panelists. What role do you think healthcare professionals can play in bridging the gap between the medical community and lawmakers on this issue, especially, as you mentioned, Senator Cook, as far as wanting more healthcare professionals to be comfortable using their voice to advocate on this issue?
I think that one of the nursing skills, especially, and I think it's most prominent in nursing, but it's true of all of the healthcare positions that you can hold, is the ability to translate something complex into something digestible and simple for folks to learn. So, how can we as healthcare professionals show up and hold the line on intellectual integrity? Like, it's important to understand what's a good study and what's a study that actually doesn't hold up to rigorous scrutiny. And how do you help people understand what is misinformation and what is actually scientific? And that is an important role that physicians have played in our society for a very long time. And there's a real issue with anti-intellectualism that's taking place right now, that's chipping away at physician credibility. But that doesn't mean that it's a foregone conclusion. Someone is pushing hard in one direction, we have to push hard back in the other direction. And we have to hold the line on intellectual integrity and being able to take data and give it to people in a way that's digestible and applicable to their lives. And then again, I think we just absolutely, in this sense, we've got the data, we know what works. Why hasn't it been passed? It's because the power is not distributed in a way that the people are able to have influence over the process, like our democracy, I think, is intended and designed to work. And so how do we begin to really shift power? How do we build, as healthcare professionals, build political coalitions? How do we organize in a way that is constantly building capacity and shifting power? How do we become a threat to the politicians who refuse to take a data-driven approach on this, or who don't have the courage to stand up to the lobbies that continually shape the policy in the gun safety space? So I want to see healthcare professionals taking that role very seriously, holding the line, and then being very engaged and being willing to learn new skills, to build political coalitions, to be clocked in even after very, very long hours, staying engaged with the issue so that we can build a different political system and hopefully prevent violence before it happens.
Thank you. Representative Lalani, I'll toss it to you. And I'll just
Okay.
yeah,
Can you hear me now?
yes, thank you.
Good evening. My apologies for joining you guys a little late. Few things were happening, and some technology challenges were part of it too. But here I am. Do you shoot me any questions, or I
Thank
should
you.
talk, or what do we want to do?
Yeah, so I'll go through the panelists right now. I'll ask you just the same question and get your perspective on what role do you think healthcare professionals can play in bridging the gap between the medical community and lawmakers when it comes to gun violence prevention advocacy in particular?
That is an important part, and I've made a general comment that bad things are happening because good people are choosing to stay quiet. By that I mean, I'm not talking to you all is preaching a choir. You all are engaged, you all know, and you are all activated, and you are in the trenches all the time. But I'm pretty sure if you open up your phone books, you will find people who are your good friends, who are very much unengaged, very much indifferent with the attitude. Some of them may not have the confidence in the system. Somebody may not care because it has not happened to them personally. Uh, so I think the power lies within us, and power lies in educating and engaging people, and power lies in to be persistent. I can't tell you enough that somebody will come with so passionate ideas to me, and I'll say, yes, I will see in you, Austin. And then the small face is made like, oh, I can't come because I have this, or I have that, or I have that. And in the back of my mind, I'm saying, well, I knew your, now I know your priority. Would you take a day off to do something if this is really, really important to you? So I think what I'm trying to say is that we need to excite the people, excite the public, and make sure that we engage them enough so they get activated. To the legislators, let's become engaged and give them your personal stories. People can read the data. We know that 300 people died so and so day, or every 2 hours somebody has been killed with gunshot and whatnot. But these are not numbers; these are human beings. So you have data, right? You are in healthcare. You're seeing patient. You're seeing family. You're seeing firsthand injury that has happened. You're seeing the second-hand injury. You're seeing the like Senator Cook was saying, long-term effect of injury, right? I have seen young people in nursing home with quadriplegia and gunshot, right? So we have all our stories, I think, but I would focus on or emphasize is bring those personal stories, because that's what people want to hear, and that's what they will relate to. Okay, it's a number one. Number two is engage, engage, and engage, and persevere. Please. It's not that I made one phone call or I came one time and then I sent one email. No. Send an email, send a phone call, go meet with people, and then maybe make it a day that have a team out that I will call this week, and maybe you will call the next week, or the third person will go and meet in person, and we'll create the story like, I'm here, you heard that phone call from my friend, I'm here. Find the constituents, but that's the magic number. I mean, if you go to any elected and say, I'm your constituent, they will find time. So find people that they will engage, and that's how we can start this thing going on. Uh, I get frustrated like many of you because we know the statistics, we know the harm what is happening, but we are not communicating effectively, or we are communicating to the deaf ears. I was talking to one of our medical societies, and we looked at it, and as I do primary care geriatrics, so we're looking into, there are 70,000 physician offices in Texas. Each office has about 300, 400,000, 2,000, 5,000 patients. If we talk policy with each patient, you don't talk about voting or how you don't get party, but you say good policy, why this has happened. And if we can convert 10 activists in an office, we will have 700,000 people, right? Imagine those people standing in the corridor of the hallway. They're standing in the parking lot of the Capitol. You don't need to go to anybody's office. They will come running down asking like, hey, can I have a 2-minute audience with your crowd? Because I'm sure they are my voters. That's the power we have. That's the power we need to create. That's the good trouble that we need to create. Get the media, give those story that, hey, I met this young gentleman who is unfortunately is now in a bed because he's quadriplegic from that. Create that 1 minute viral video, create that education part. And I think that's what we if we keep doing that and bring those stories, that is powerful. Because one other thing is, in healthcare, we have the credibility that other profession don't. People will call you middle of the night for their life, right? They will not call anybody else. And then if you tell them take this medicine, they will take it. So you have that credibility. If you tell your patients and your friends that this is what you're thinking, this is what you're seeing, this is what is happening, they will trust you, they will believe you. And I think that's the power we need to use.
Thank you. Yeah, I think part of what we're trying to do with this healthcare coalition program of Texas Gun Sense is really to, as you mentioned, as Senator Cook mentioned, kind of bring back the focus to folks that do have this credible background that people do trust in society, and really get healthcare professionals on the front lines with us in this movement. I do have more questions for you specifically, but I'd love to toss it to Dr. Dark and then Dr. Gamble in just as non-legislative roles, what you all think that healthcare professionals can play in bridging that gap between the medical community and legislative advocacy and lawmakers.
Well, I think Senator Cook alluded to one of the big things is be involved with your specialty society, because I think a lot of our specialty societies are focused on typically one thing, which is how well we get reimbursed. And if we want to actually have them focus on more social issues, we have to be involved and participate in sort of the deliberative process at that level in order to get emphasis behind and behind the specialty society, so they can then use their lobbying efforts for some of these other issues. I think two other things. One is serve as a resource for your local representative, because most of them are not doctors or nurses. Most of them, I would say, are lawyers. And so by being, almost, I wouldn't say pester them, but be available to them, and be able to explain what you see at the bedside every day, because not all of their constituents are going to be in healthcare, but you ought to be able to be that person and that resource for them to explain it to them. And that's largely helpful. And then third, doctors got to open their wallets more, because we are notoriously cheap. One of my friends ran for Congress this past cycle. And one of the things I tried to do was to be, one of his earliest supporters. But one of the things that he taught me was how hard it is for physicians to get money from other physicians when they're making these runs. So that's another thing we have to stop being, is cheap physicians. We make a good amount of money, but the lawyers blow us away.
I love all those ideas and those suggestions. And I was trying to think of other things that people haven't already said, and I think I'll just reiterate a couple of points. But I think, kind of from the physician side, I think there's really three core pieces of this. And I think Representative Cook mentioned this, but we're trained in science, and all day, every day, we translate that science into terminology and into explanations that everyday people can understand. And I think doing that exact same thing, through the media, through legislative visits, through one-on-one contacts, advocacy days, all of those things is really kind of a natural skill set that we have, and one that I think is really important to utilize. The next, which I think Dr. Lalani said as well, is that we just have this profound credibility at the Capitol that I don't think, I've told this story a lot, but when I go to the Capitol as Dr. Lauren Gamble, I'm treated so much differently than if I go just as a mom or as an advocate or as a concerned citizen. And to be clear, I don't think that's the way it should be. I think everybody that goes to the Capitol should kind of garner credibility in that way. But the reality is it's different. And so I think using our professions and kind of that natural credibility that comes with that is really sort of responsibility for all of us, I think. And then last, I think we just really have a perspective and an angle on this that most people can't see. I think when you're in healthcare day in, day out, you talk to patients, people tell you things that they've never shared with anybody in their whole life. And you witness it. You're there. You're the person that knows how this policy is impacting real people. And just shining light on that in a way that our legislators that are not privileged to see those things, see those stories. It really, you never know how it's moving the needle for people, and it may just be the visualization they needed to slightly shift their perspective, moving us closer to better policy. Also join Texas Gun Sense and show up and donate and go to Advocacy Day on February 27th, I think. And just get engaged, just show up and be there.
And that's actually a perfect segue into I do want to ask one more question of Representative Lalani specifically. You mentioned the power of showing up in mass at the Capitol. Are there any specific tips as we gear up for our Gun Violence Prevention Advocacy Day in February for healthcare professionals that are coming with us to meet with legislators, especially legislators that on the more conservative side that oppose our efforts for gun safety laws, and just ways to be effective and framing the conversation with those folks that oppose our work?
Yes, I think there is. And before I go further, I just wanted to add two more points. The speaker before me, I can't actually read the name, but you said we don't want to pester, but be available to the legislators. I would say no, pester. Pester, make the life miserable, because one life saved is one too many. And you don't want to do that. Just because of your 900 calls, if one life is saved, is worth it. So be that. Have that attitude, please. Now coming back to the Capitol, how we can do, I think you can do is come prepared. One thing what we do is we have so many important things in our mind, right? And we want to catch up on things when we are there. So I generally tell people, okay, make a list of whatever is important to you, let's say for the gun sense for that Capitol Day. And once you make a list of 10, 15 items, make sure you highlight what is urgent to you. And then only talk about that urgent part. And so come up with some consensus that we will be very specific and we will be very clear in our ask. If you go to a legislator and you give them 10 stories and you ask them 10 asks, they are vanished after 10 minutes in their mind. Or somebody else comes after you and give two other different points. And then so it becomes a little bit, everything is important. I'm not arguing on that part. What I'm saying is let's make it urgent, like what I want to do in 2025 or what our group wants to do as a 2025, create one goal. And then everybody talks about on that. Everybody has a story on that. And then maybe create one pager with some visual and some data on it for easy viewing and leaving back to the office. So very specific, very clear on your ask. That is important part. Number two, follow-ups. Make sure that you are following up or even pre-coming, like, hey, Representative so-and-so, I am coming to your office on so-and-so date and we will come. How can we be helpful? Or just preempt them with those things. And then when you come to meet them, you say, hey, I was the one who made a phone call. Learn a little bit personal stories about your legislators. They all are humans too, right? So see if somebody has a kid, somebody, if you meet them grocery shopping at the Walmart, say, hey, how are you? I saw you and I really love you helping out on so-and-so issues. So learn what they are working on. Learn what they are doing in their life. If they have done something in the community, compliment them. So not your visit is always, it's all 10 minutes is lost into ask. Maybe compliment them. Everybody likes to hear compliment, right? Including all of us. As simple as, hey, that's a good shirt you're wearing, or you're looking very nice today, or whatnot, right? So small compliments, give them what they've achieved. A lot of time people go to the legislator just for the ask, or when something is wrong. Just like when I tell my staff also that you don't need to call family when something is going wrong on a patient. Sometimes you can just pick up the phone and say, hey, I was with your mom and she had a good lunch. And you don't know how much that son or daughter will appreciate their phone call that when I went and saw my mom in a nursing home, she was in the mess. That's the mind or image they have, right? But once they get that story that, hey, I was with that, mom was happy, and we fed, and she finished the whole plate. So create that human bond, that relationship, and then follow up is important. Emails, phone calls. A lot of times we forget about the staff. Learn the staff of the office, so you can make that connection to learn where their local offices are, where their capital offices are, so you can communicate, and then keep following up. And I would use the word yes, pester them enough that they look into. They understand that, man, this guy is calling me 3 in the morning. I see his emails come in this. I see this happening. I see that happening. This must be something important. And then appreciate if they have responded to you. Maybe make a good post on social media, say, hey, I connected with so and so, and I'm so happy and thankful for your time, or so thankful for doing this. So give them some credibility. Also, what I call it is a soft slap, right? So give them very nice thank you doing this, by the way, I want this to be done, or you have forgotten, or you're behind on this. Another important thing that I would do is find the constituents to that particular office. So if you are coming to the Capitol, divide yourself and see who is your legislator is, and then try to go to the office who is your legislator, or find somebody in your friend circle who is there. So when you say, hey, I'm John Smith and I'm here to visit, it's a very different than say, hey, I'm John Smith, who's your constituents, and I see your son was at the Walmart or at the ball game, or at this. That's a very different connection that happens. So find somebody who's in the district, who are the constituent. Be very specific and clear in your ask, and be very persistent in follow up, and in personal stories. That's everybody can read statistics,
Right.
but personal stories.
Thank you. Thank you. That's very helpful. I want to toss it to Dr. Dark again. So from your perspective as an ER doctor, what stories or experiences with gun violence victims have impacted you most and kind of led you to really take on this gun violence prevention advocacy role?
Um, there are a few. I think one, and I kind of opened my book this way, is talking about my own cousin who was shot and killed, probably around my age, you know, um, with his own firearm. And it's one of those things that, and I didn't really know too much about it because it happened when I was a teenager. But eventually my mom, who like keeps all these records, and she's like our family genealogist, essentially, like she had his death certificate at the house. So like a couple years ago, I actually got a look at it. And, now having filled these out as a physician myself, I kind of can replay what may have happened, that evening. So I think that's one thing on a personal level. But I think a couple of ones that hit me harder, and I think, Dr. Gamble could probably appreciate this, is I remember a car pulling up over at St. Luke's, and it was like riddled with bullets, and a bunch of people got pulled out. One of whom was like a 6-year-old kid who essentially, my kid at the time was like the same age, shot in the arm and broke a bone through his arm. But I think when you see cases that remind you of yourself or people that certainly is impactful. And I think those are probably the ones that kind of get me the most and encourage me. Like, for instance, that one, I was like, there is literally no reason for a 6-year-old to get shot. Like, okay, maybe I can understand some teenager that maybe is out there getting in trouble and mixing it up with somebody. Okay, I could see that. Or maybe like some adults that are in an argument, I could understand that. But like, what does a 6-year-old do to deserve getting shot? So
Thank you for sharing that. Dr. Gamble, I'm curious the same, if there's um, any specific experiences that really pushed you into taking on this advocacy role as well.
I've been thinking about this a lot lately because I feel like people keep asking me, just in general. But, I think it's just been pervasive in my life personally as well. When I was a kid, my neighbor was killed in a drive-by shooting, and she was 7 and I was 9. And I think that really just sort of like started this in a really early age. But I think like from the very beginning of my medical career, it's just been so many patients when you least expect it, kind of impacted in all different ways, not just that direct violence, but those ripples. That has just really always been a part of this job for me.
Thank you. And I've got really one more question for each of you, and then I'll open it up to some Q&As. So if folks want to start putting some questions in the chat, and I can pull from there to speed things along once we get to Q&A. But whoever would like to go first, what do you think is one actionable step that advocates can take to support gun violence prevention, especially from like healthcare professional backgrounds, and yeah, especially as we're getting up for Advocacy Day next month?
Can I interrupt and take a minute or two?
For sure. Mhm.
The other thing that you also can do is read about the legislation and who is filing what bills. And then when you go to your legislator, make sure you make the ask that, hey, for example, Dr. Lalani has filed so and so bill. I'm supporting. Would you support? And if the answer comes yes, then that's good. If they say, I don't know, more information, how can I help? Because ignorance plays the biggest part in the fear, right? So educate them. Okay, so when you are on Austin, have a little folder of few bills with you, bill number, who is filing it, and then you can talk about that. Okay, this bill has been filed. I really support this. This is happening, and then tie up a story. Like you just, three of you said a story, right? Tie up on a story to that bill, that why it is important, how it's going to help, and why are you supporting. So ask them a planning point blank question. Would you support this? Can I tell Dr. Lalani that he can expect yes on the vote from you? If you're talking about Texas House, if they say yes, then make a list of it. So now we know who are our supporters, and then now also make a list of who we need to more work on, right? And people who have said no or people are hesitant, then we know that we need to make a little more bullet points and keep going. I know that I have to send my people to their offices. I need to meet them on the hallway, talk about this particular subject. So then we can start harping into those aspects of it, right? So there are a few bills that I have filed last time that I'm filing it again. And I think to me, it makes all the sense. And I'm sure it makes sense to a lot of people. Again, we know the knowledge, but we are not communicating effectively, right? Or communicating to the deaf ears, or if they are, somewhat hesitant or fearful. A lot of Republican actually are in favor of bills. A lot of voters who wants, the regular Texan are in favor of these bills, right? But we need to make sure that we toot our own horns. So one bill, for example, is I'm putting is prohibiting firearm access to sex offender. Does it make sense? Somebody who has to notify you if they come to their neighborhood, and is it not common sense that they should not have a firearms? Why can't we not, right? So I'm one bill I'm filing that part. Create one story. I'm sure you will find somebody who has been affected of it. There what I hear that almost 30% or more of the household Americans hold firearm, right? And I think 40 or 45% of people live in the household where the firearm is, where this domestic violence things are happening, where other things are happening. So create the story and talk about that. This is one bill which is coming, and if you want, I can give you bill numbers on it. That hey, this is. For example, prohibiting firearm access to sex offender, HB 260 and HB 770. We are not talking about First Amendment, Second Amendment rights. We are talking about education, safety, safekeeping. We heard the story a few weeks back, right? The young, I think it was a toddler or somebody, somehow got access to the gun from the glove compartment in the car and shot the mother. So I have a bill which I'm saying that is strengthening penalties for child firearm access. So if they are neglecting in doing that, we need to have more penalties. Does it make sense? I mean, that kid lost a mom who was now not, so if we had those kind of things that we can help people who are uncertain, like as a physician myself, most difficult part for me is when I take somebody's driver's license when they're not competent, because I do geriatrics. I'm sure you do different fields, right? So if we can take that away from because somebody's unstable to drive a car, why can't we not, law enforcement, take away a firearm from somebody who is not stable? So I have a bill in that regard. So, let's bring those particular issues, those particular bills, and have a specific ask, and then let's make a list. Make a list like, Senator Cook, Dr. Lalani, here it is the list. We went to all these people. These are for it. These are against it. These are thinking. So then we can come up with a strong front together and say which offices we need to work on more. What information do we need to do? What kind of questions they're asking? Is there a constituent that we can find in their district who would call with the story? Would they be more receptive to that? And I think that's how we will win the battle.
For sure. I do want to bring it to some of the questions that folks have put in the chat. We've got a really great one that I think Dr. Dark has already answered a little bit in the chat, but someone asked, how can a patient persuade a doctor to become involved in advocacy regarding gun violence? And I'm curious, especially Dr. Gamble, as far as just working with, I'm sure a lot of parents of kids that come through your office, if there's yeah, if there's any perspectives that you have for how people can really convince their doctors to get more involved on this issue.
Such an interesting question. I think a lot of doctors don't realize how much influence and power they have in this sphere. And I think just encouraging, like asking them. I mean, I think just bringing it up and asking them and saying, I think, you have an important perspective to share here, I think could be really powerful. And I think it's worth their time, right? Like that it's something that it's valuable and it's worth their time and it's important. I think there's a lot of hesitation because people feel like there's so many tasks, there's so many things that need to be done to take care of patients, but really this is looking at health and well-being more broadly. And I think kind of reminding them of the big picture of, if we want to make the world a better place for all of our patients, this is a critical issue that we need to address.
Thank you. And just to share it as well, and Dr. Dark, if you have any more comments on this, but Dr. Dark said in the chat to remind your physicians that their duty may extend outside the walls of the exam room and into the community.
Yeah, I'd just like to remind medical students and physicians about Rudolf Virchow, who all of us know through the little triad of hypercoagulability, but he also is the father of social medicine and talks about how medicine's a social science and politics is nothing more than medicine at a large scale. So it's really on us to be more active than we currently are.
And also remember, physicians are also humans and regular people too. So sometimes they appreciate the input that comes from the other side too. So how we present the data, and then there are all those support groups and things you can always pass that information to that. Hey, would you join this colleague, or that so and so program is happening? Bring that invite to them, invite to the other programs that are happening, events that are happening, and then they will get into.
Awesome. I do see a hand up, Swati.
Hi, everyone. Thank you so much for this space. I have so many thoughts and comments about all the different things that were talked about. Most importantly, Representative Lalani, mentioned many times, have your bullet points, have your talking points, and then go and talk to your legislature. So I've been doing this for many, many, many legislative sessions. Really, the most effective use of time is not necessarily talking to your legislature, especially if your legislature is a friendly, because you can do that at your local office here. The best use of time is to kind of go in mass to representatives who aren't quite on your side and to kind of do the research and figure out, okay, who is most likely to be swayed? Who is most likely to sit and be willing to have a conversation? Very often, I find that it is very difficult to have those conversations. And we know the stats are out there. We know the evidence is out there. It's been there for years and years, and we know what people overwhelmingly think. And yet, our representatives elect not to vote according to what their constituents want most of the time. So we end up having to do this in small increments. We didn't get here overnight. And so we're not going to change the culture overnight. And we have to start with small wins. You were talking about sex offenders not having access to a firearm. Wholeheartedly agree. But most sex offenders are felons. Felons already, it's already in the books that a felon shouldn't have access to a firearm. The issue here in Texas is, just like somebody who there's a protective order against a domestic abuser, they shouldn't have firearms. There is no process to relinquish them. That is what is missing. Being able to just say, oh, we want this, we want that. There is no process. So we have to start small. And we have to build each session. And I hate that. I hate that we can't have the change that we need right away, but it's just not going to happen that way. And so we need to be talking about what are the small things that we can do, the practical things that everybody can agree on, not this legislation that makes sense, but what are the small steps to get to the bigger picture? That's what's missing. And then in terms of the comment about pestering, we're not pestering. We elected them. They're there because of us. It is incumbent upon us. It is our responsibility to talk to them ad nauseum, because that's what we do. And I could go on and on, but I'll be quiet.
Thank you. I do want to flag one question that is related as well from Sue Bornstein. She asked in the chat, to pass legislation in the Texas House, we need Republican support, and asked for thoughts on how we can engage Republicans in this work. If any of the speakers have a good perspective on that.
No.
I think bringing real life stories is important. Staying engaged is important. Staying persistence is important. And then making some good trouble is important. And I said, when we talked, and if they agree, not agree, then let us give that feedback is important. So not just coming to the Capitol for one day. This is a long haul that we need to do. And then, let's bring what are their hesitations are. Does it require a legislator to legislative talk? Then we can find, okay, I have a list of these 5 legislators. Dr. Lalani, would you go have coffee and talk with them one-to-one? Is it constituent to the legislator issue? Are they scared of something? And do we need to build up a 25 or 30 constituents who's going to make a phone call to them? And would that sway? Would that create an event in their own district of what has happened? How do we create all of that part is important. The other point which the previous person also made, that people are not hearing us. And this is a bigger problem. Why some of the legislators are not listening to you is because they're scared. And I found out when I was doing my research, there's a threatening to do primaries. You have heard that, right?
Yeah.
Less than 5 to 6% of people vote in their primaries. Who are those people who vote? The extremes. So who are they want to make them happy so they can be reelected? Those extremes. So we need to work on a bigger goal also, not just the gun stance, but also how we can increase the voter base. How much more and more people will come and vote in the primary. If that primary voter number goes from 6% to 15, 20%, I can assure you that the tide will turn. They will want to hear you. They will hear what has been going on. Another thing, as a legislator, that I have found, whoever is on the other side and is making noise, they will be sending me 60 emails or phone calls every time. But the people who are on the right side, I probably get hardly 6 calls or 6 emails from them. And that's why I made a comment that good people are choosing to stay quiet. We need to make that noise, and then that's how we will get their attention.
Thank you. Just to respect everybody's time, I think that we are gonna have to wrap up for today. We are super grateful to all of the doctors who are on this call today, and Nurse State Senator Molly Cook. So thank you all for joining us. Thank you for your perspectives. We'll definitely look forward to working with you moving forward on this. Before we hop off, I do want to say in the chat, Nicole has put the Advocacy Day link in there. So February 27th is coming up very quickly. We'll be at the Capitol with the Texas Coalition to Prevent Gun Violence to really push for some change and work on some of the folks that are not as supportive of our cause. And then I also put for any healthcare professionals who want to join this coalition and just get periodic emails to help us advocate at the Capitol and beyond session. The link is in the chat as well to join that. And if you are signed up for Texas Gun Sense emails, we will still be sending out some more recruitment emails to get more healthcare professionals involved. And if you're not a healthcare professional, or you are and you're already part of it, please send the link around. Everyone is welcome in this coalition. We're really excited to just be able to bring these perspectives and these, strong points with us as we go to the Capitol. Thank you all again for joining. And Nicole, is there anything else you'd like to say?
I just want to say thank you. That was a great wrap up, Garrett. And I really appreciate speakers and audience members. And I know we could talk about this forever. So just stay tuned for more. We're really growing this healthcare program. And so we'll be getting in touch with you all about how to do that effectively and what you want to do more of. And there'll be way more opportunities. But we'll see with the Capitol on the 27th. And I just want to kind of put another plug in for, I think, what I heard Swati indicating, which is that our work is incremental. So step by step, we're building progress, and it takes a long time. And so stay with us, keep doing what you're doing. Let others know that that's what the work is, and we'll see you soon. Thank you so much.
Thanks, y'all.
Thanks.
Thank you.